We talk about fentanyl so much these last few weeks. Now, the DEA announced the first ever Fentanyl Awareness Day. So our 9 Health expert, Dr. Payal Kohli, is with us today to talk more about the drug and what it does to the body. So what can you tell us about fentanyl, its medical uses, and why it's so deadly?
I'm so glad that we have this day. I think it's been a long time coming. And fentanyl is involved in 66% of opioid-related overdose deaths. So it's something we really ought to be talking about. Now, fentanyl is usually a drug used to treat pain, post-operative pain or chronic pain. But what a lot of drug traffickers are doing is lacing the drugs that are on the street with fentanyl because it increases their addictive potential and makes them have repeat customers when they do that.
So fentanyl has a medical use. It is commonly used, and now it has this black eye, because when we talk about fentanyl, we're talking often about people dying.
Yes, and unfortunately, we're seeing a lot more fentanyl on the streets than we are seeing in medical use. And the problem with fentanyl, it's a very effective drug for treating pain because it's 50 times more potent than heroin and 100 times more potent than morphine. But the problem is not only is it more potent in relieving pain, it's also equally more addictive. So if you start to lace substances with that, it triggers those receptors in the brain, triggers that pleasure response, and people get addicted.
Okay, and then in some cases, people die when they don't know what they're getting. But when you talk about pain, for a lot of people, it is chronic pain that they're living with, and they really need it.
It's so true, and the problem with pain, some of it is perception in our brain, but some of these opioids, they stop working as well over time. So that's called tolerance. So whether you're talking about pain or the pleasure response, you need more and more of that drug to elicit the same sort of response, the pain relief or the pleasure response. And that's what makes it so addictive, but that's what also makes chronic pain such a challenging problem to treat.
How would you know that someone's overdosing or has been poisoned by fentanyl? How would you know? What can you do? How much time do you have?
3 classic signs that we should all know about. Respiratory depression. So fentanyl, that's how it can kill you. It makes your breathing slow down or stop. Pinpoint pupils. So open their eyes and look, and they should have a little tiny pinpoint pupil. That's the black part of the eye. That tells you that there's too much of an opioid on board. And the third is a lack of consciousness or altered level of consciousness. So if you find somebody collapsed, you worry about a fentanyl overdose, open those eyes and look, and call 911 right away, because you have seconds to minutes before that lack of oxygen to the brain is going to cause a coma or vegetative state.
Is narcan effective? Is that something that can work against a fentanyl overdose?
Very effective. In fact, if you live with somebody who takes chronic opioids, you should make sure that you have narcan at home, you know how to use it. And of course, when the EMTs come, that's the first thing that they give is narcan. It can also now be given intranasally. So you can, give it in the nose if it's something you're not comfortable giving through an intramuscular injection or IV.
Just last week, our Chris Vanderveen shared a really compelling story and how a sheriff's deputy saved a woman's life. But, this is one of these things people kind of don't want to talk about, but we really do need to do it. And as parents, we just need to accept it and talk to our teenagers about this.
We really do. And the problem is, because of social media, it's become now so common for a lot of these drug traffickers to prey on our kids and to target them. So the DEA has actually put out this list of emojis that every parent ought to look at, because this is a secret code way that drug traffickers now communicate with our kids and with each other. And it's really important for us to be aware of it. It's also important to make our teenagers aware of this fentanyl problem, because they might think they're buying Adderall or something else, and
Xanax, all of those things. Yeah,
well,
exactly.
Sad to say, and thankful that we'll get a chance to talk to you more about this. Unfortunately, we will need to, but hopefully we can also help as well. Thanks, Dr. Payal Kohli.